Good day, ma'am. I am Powell James C. Tabogoc, a student nurse from the University of Eastern Philippines, and I'm here in front of you to perform head, face, and neck assessment. Before we proceed to the assessment proper, may I know first your name and your date of birth?
I am Diana Jane L. Del Monte. I was born on August 18, 2003.
Okay, so how would you like me to address you po, ma'am?
Miss Diane.
Okay, so Miss Diane, I am here I am here to conduct head, face, and neck assessment. And I am doing this in order to gather baseline data and to identify any abnormalities so that it will be addressed immediately. So in this assessment, ma'am, Miss Diane, I will be touching some parts of your body. Would that be okay, ma'am? Okay, so I assure you that all the documents and findings are completely confidential to me and the attending physician that I'll be referring you to. So far, are there any questions, ma'am?
None.
Okay, so what language are you comfortable po? English or any?
English.
Oh, so you're comfortable in English. So we will use English as our mode of language. So before we start our assessment, let me ask you these questions first. So, are you experiencing a headache?
None.
Okay, so are you dizzy?
No.
So are you lightheaded or have a spinning sensation or feeling?
None.
Or are you near losing your consciousness? Okay, so do you have lumps or lesions that haven't healed yet or disappeared?
None.
Okay, so do you have difficulty moving your head?
No.
Are you having pain? Okay, so for your past history, did you have injury in your head, face, or neck?
None.
Or any surgeries for that matter? Okay,
None.
so none so far. So for your family health history, does your family have a history of head or neck cancer?
None.
Okay, so how about the history of migraine?
None.
Let's now move on to the questions regarding your lifestyle, ma'am. So, do you smoke or chew tobacco?
No.
Do you frequently experience secondhand smoking?
Yes.
How frequent po ba?
Almost every day.
Almost every day. So, do you wear a helmet, a hat, or a hard hat?
No.
So, what is your typical posture when relaxing?
I sometimes straighten my body or slouch.
Okay, so how about when you are sleeping?
I lay sideways.
Okay, so when you're working, ma'am, what is your posture or position?
Same with relaxing. I straighten my body or
Okay,
slouch.
so let's now proceed to what types of recreation activities do you do?
Cycling.
So healthy. So on a scale of 1 to 10, how are you satisfied with your appearance?
7.
Okay, so I am now going to do the assessment, but before that, I will first conduct a hand hygiene. And close the curtains to provide privacy. Assuming that I have already closed the curtains to provide privacy and have conducted hand hygiene, so, ma'am, I will now put on the gloves before we proceed to the inspection, before we proceed to the assessment proper. So now, ma'am, I will now be starting our assessment. So I will first inspect and palpate your head. Will that be okay po, ma'am?
Okay, sure.
Okay, so let's start po with inspection. Can you stay still po? So I will now start palpating po your head. Is it okay po, ma'am? I will now start po, ma'am, inspecting your scalp. So let me check. Yes. I will also check the back po, ma'am. Ma'am, so upon inspecting and palpating your head po, I have noticed that your face is symmetric and it is very hard, of course, and it is round and it is in the midline. So I have also gathered the data that your head is normocephalic, which is appropriate for your body, and I have I haven't seen any traces of lesions, scars, infestations like parasites or lice, and I haven't found any masses and signs of alopecia or hair loss. So ma'am, right now, I am now inspecting your face po. Can you please sit still so that I can inspect or observe? I can observe. I will now inspect your face for its symmetry, features, movement, expression, and its skin condition. So, can you sit still po ma'am? I will be observing it po. Okay, so now Miss Diane, I will now check your cranial nerve number 7 or your facial nerve. So you should, can you please ma'am do the things that I instruct you to do? So can you raise your eyebrows? Now lower it ma'am. Can you blink? And now ma'am, can you shut your eyes tightly? Like tight. Okay now, so open it ma'am. Can you smile? Yes. What a beautiful smile, ma'am. So, can you frown like this? Yes. Can you puff your cheeks? Like this? Yes. So, ma'am, I have gathered here the data that your face is symmetrical. Or all the facial features are symmetrical, and I haven't seen any abnormalities po. And there is no drooping that is occurring on your face and both sides, on your left and right. There is no droopy. It is leveled po, ma'am. So, ma'am, now I will palpate your temporal artery po. Is it okay if I touch you again? Can you bite your teeth? Can you release? Bite again. Okay. So, ma'am, I will now be checking your temporomandibular joint. So, ma'am, can you open your mouth? Close again. Open again. Close again. Okay, so thank you, ma'am. So far, ma'am, I haven't suspected or I haven't gotten any swelling, and there is no crepitation of movement po. And let me ask you a question po, ma'am, first. When I palpated or touched when I palpated your temporomandibular joint or your temporal artery, did you feel any pain po ba?
No.
Okay, so very good. In these past few days po, ma'am, did you experience po ba headache? Okay, so let us now proceed po, ma'am, to our neck assessment. So I will now start inspecting your neck po. So can you slightly extend your neck above? So I will just inspect it po. Okay, so far so good. Wala na po. I have here po, ma'am, a glass of water. Can you please po intake it without swallowing it, without my permission? So, slightly drink it po, then slightly extend it up. Can you swallow po, ma'am? Okay, so okay po, ma'am. So far po, ma'am, I observed po that your trachea is in the middle line, and your here po, when you were swallowing kanina the water, it moved up, and that's totally normal po. And I haven't seen or I didn't saw any signs of bulging or swelling po sa iyong neck part. And so I have a question po, ma'am. When you were sipping po ba kanina, did you feel any pain? Okay, so how about when you were swallowing the water? Sige. So now, ma'am, I will now be inspecting your cervical vertebrae po. So I will put you back. I will lift your hair po, ma'am. So can you flex po, ma'am, or nod? Okay, so can you look to the left po? Okay. How about to the right? Upper po, ma'am, konti. Lower po. Okay. Okay. Ma'am, when I checked your cervical vertebrae, I didn't see any abnormalities or any irregularities in that area po. So now, ma'am, let us now proceed to inspection of your neck range of motion. So I will instruct something, ma'am, then can you please do it po? Can you look to the right? Full pa po, ma'am. Okay, can you look to the left? Okay. So, can you touch your ear to your shoulder? To the other side? Okay. So, can you put your chin on your chest? Or can you lift your head to the ceiling? Okay. So, ma'am, while doing po all those that I instructed, have you felt any pain? No? Okay, so, ma'am, now, I will palpate your trachea and I will do it po at your back. So, excuse me, ma'am. Okay, ma'am, so I can observe or I can feel that your trachea naman po is in the midline. So, can you swallow naman po na, ma'am? Okay. Again. Again. Sa isa po. Swallow. Okay. So, So, ma'am, I have observed that your tracheal rings naman po are working and your swallowing was good naman po. Did you experience any pain while swallowing? Okay, none. So now, ma'am, I will ask you to look up. And can you please look here? Okay, so now look here po. Okay. I can see that it is really in the middle of your trachea. So now, ma'am, I will auscultate your thyroid gland to see if there are any present roots po. Okay, so can you inhale po, ma'am? Hold it and exhale. Okay, to the other side. Can you inhale? Okay, so hold it. Exhale. Okay, thank you po, ma'am. So far, I didn't hear any presence of roots and your carotid arteries po are functioning well. Let us proceed to the last part, which is the palpation of your lymph nodes. So, I will touch you again po, ma'am. So, can I do it po? Okay, so let us start with the pre-auricular. Okay, so your post-auricular. Okay, so let's proceed to your submental node. Let's proceed to your submandibular. Okay, so let us now assess your retropharyngeal. Okay, so what do we mean? So let us now proceed to your anterior cervical. What about your posterior cervical? Your supravicular nodes. Okay, your occipital. Okay, ma'am. So that would be all for your assessment. So far, I haven't seen any abnormalities in your lymph nodes, and that's it po, ma'am. So the assessment for your head, face, and neck is now done. And all I can say po is to your health is it's normal naman po. And all I can suggest is you take your vitamins daily and drink lots of water. So thank you po, ma'am.
Thank you.
Once again, I am Powell James Tabogoc po, your student nurse from University of Eastern Philippines. So thank you.